As we close out our Breast Cancer Awareness Month series, we want to address a topic that's specifically for Black women, our hair and what we put in it. The Black Women's Health Study focuses on cancer risk in Black women and the latest research about the correlation between breast cancer and hair relaxers. Dr. Kimberly Bertrand is co-investigator on the study and an associate professor of medicine at Boston University. Thank you for starting your day with us, Dr. Bertrand, and to share this very critical and important information with our viewers.
Good morning. Thank you for inviting me on.
So first, Dr. Bertrand, just tell us about those disparities that we hear about between Black and white women when it relates to breast cancer.
Sure. Unfortunately, in the US, we still have major racial disparities in outcomes for breast cancer. Overall, breast cancer is relatively survivable. The 5-year survival rates overall are about 90%. But while Black women and white women in this country are diagnosed with breast cancer at about the same rates, Black women are 40% more likely to die from their disease.
And just talking about this study, the Black Women's Health Study, it took 25 years. It's in the 25th year. Can you just give us an overview of this study and the biggest takeaways?
Yes, sure. So overall, the Black Women's Health Study began in 1995 when 59,000 self-identified Black women agreed to participate in a long-term study on the health of Black women. And they started by filling out questionnaires about their health and their exposures, such as smoking, alcohol, medical history, everything like that. So these women began the study free from cancer. They were all at risk of cancer, but free from cancer. And what we did was we followed them over time to see who developed cancer, especially breast cancer, and who did not. And we can compare their past history with respect to the exposures that they may have been exposed to. So for this particular analysis, we asked women back in 1997 whether they had used chemical hair relaxers to straighten their hair, how frequently, how often, how many years had they used it, what types of chemical hair relaxers had they used. And I would say that overall, our results with respect to breast cancer were actually generally very reassuring. Overall, there was no strong link between the use of these chemical hair relaxers and breast cancer risk for most products and most women. However, we did find a concern that women who used lye-based products, the active ingredient being lye, those women who used them for many, many years, more than 15 years, and very frequently, more than 7 times a year, there was a slight increase in their risk of ER-positive breast cancer.
See, that's the interesting part when I was looking at the study, was talking about the lye to no lye when it comes to hair products. And I know for me, I do use hair relaxers, but I only use them every 3 to 4 months as needed. And mine, the box that I get says no lye on it. So could you talk more about why lye is just not good for your health overall?
Sure, absolutely. And actually, I'm glad that you raised this because these chemical hair relaxers, they contain thousands of chemicals, some of which are known to be toxic and others may not be. And one of the active ingredients in some products is lye, which is just sodium hydroxide. It's just soap. So lye itself has not been classified to be a carcinogen at all. But the trouble is that it's a very corrosive substance. And so our skin is actually one of our body's natural immune mechanisms. It's a defense mechanism to allow other chemicals not to get in. And so what happens is if women are using lye-based products, they may be more likely to suffer irritation to their skin on their scalp or even chemical burns, which could allow the other chemicals in these products to seep into the body. And some of the chemicals may actually have specific toxicity with respect to breast cancer risks. So for example, chemicals that are known to be so-called endocrine disruptors, and they interfere with the hormone systems of the body.
I learn new things every day. Such important information, Dr. Bertrand. And just lastly here, can you just talk about what we can do as women, as Black women, to just be more aware of what we're putting on our bodies and in our bodies?
Absolutely. And so, one of the reasons we were interested in this topic is not only because it had been studied before in some other studies with mixed results, but like I said before, we know these consumer products, many consumer products, we really just don't know what's in there, and we don't know exactly the safety profile of some of these products. So for women, I would say that we should really be always aware of what is going into or onto our body. And like I said before, the major take home from the study was that for most women, especially those who used chemical relaxers in moderation, even those who used lye-based relaxers in moderation, there was no evidence of an increased risk. So really everything in moderation. And then finally, be your own advocate. If you're going to the salon to get your hair done, go ahead and ask, what kind of product are you putting on my hair? And maybe, think about your choices. We do have choices in this world. And, I would just say that being aware of everything in your life and what you're exposed to is the best way to be vigilant about your risks.
Great tips right there, Dr. Kimberly Bertrand. Thank you so much for joining us here on Start Your Day. We appreciate it.